So Laura, there are three situations that I can think of where soldiers or sailors, airmen, Marines, Coast Guardsmen are going to need to link a medical condition to their service, right? It all boils down to the medical record, right? The IDES system boils down to your medical record.
That's right.
So in a situation where you've got, hula hula airborne paratrooper who's not sought medical attention for a condition while they're serving most of the time, or a psychological condition. Maybe they even got treatment off post secretly, or a situation where the reservist is seeking an MEB or PB going through the IDES system, or a situation where someone is seeking VA compensation later.
Yeah.
Right? Those three situations, you're going to have a service connection or a link to service. Is that right?
Absolutely right. We got to say with a straight face, if the VA is going to give you money for conditions that occurred while you're in service, they had to occur while you're in service.
Or if you got treatment in a civilian hospital or civilian doctor, or
that's right,
while you were in the reserve capacity, it has to be linked to service, right?
That's exactly right.
How do you do that?
How do I do that? First of all, I look to see if it's already there in the medical records. Medical records, it's either there, it's not there. If it's there, gravy. We point to it, book, line, and verse, move it forward. If it's not there, we ask the service member why. Did you seek service? Did you seek medical care? Sometimes they did, and it's just not made very clearly. So we follow up with that provider. We try to get more appointments if we need to make sure that it is memorialized in that record. A lot of times, though, they didn't seek care at all. There's no award for being the biggest badass in the military. It's more in your heart than anything else, because you ultimately do yourself a disservice by not memorializing this in the record. It is very commonplace for it to not be there. So we work with you to make sure that your record is complete.
And I guess you got to work with providers, medical care providers, to do that.
We do, and while you're still in, it's the best standard operating procedure to see providers at the local MTF. A lot of people are referred out if they need very specialized care that your MTF does not provide, but it is really a better idea to have an active duty physician, PA, or nurse who are making the calls.
And I guess that nurse, that PA, that physician, they will write a letter, often referred to as a Nexus letter, to link that condition to service. Is that right?
Sometimes we have to make this actual letter that we attach with the packet, but most of the time it's just produced in a medical record. If it's there, boom, this happened during service, or it caused it aggravated an existing condition beyond its natural progression, or it caused a secondary condition, something else that is service connected caused a secondary issue. If any of that's in a medical record or a separate letter that connects it all, we call it a Nexus letter, and we put it forward.
Is this like when you would send that, hard charging first sergeant or battalion commander to talk to the doc and say, hey, look, I self-medicated with alcohol for 6 years to hide my back pain, and then they describe that condition?
Sure.
They go back and do some images and that type of stuff?
Right. A lot of my conversations with service members revolve around just letting it go, taking the mask off, not in a pejorative way, but just, you don't have to be a service member when you're talking to me. If you self-medicated, if you went to a provider wrongfully, everyone knows what I mean by that who's watching. It's not in your record. It's not in your official service treatment records, but it's there. And it's a bigger problem than whatever else has actually gotten you into the med board in the first place. We need to know it. Quite simply, we need to get it all prepared, make the packet full and sufficient so that you get what you are entitled to. If it's not there, it's not there. And you're going to whine the rest of your life and be miserable, quite frankly, that the military didn't give you what you were due. The VA didn't give you what you're due. They can't give you what you're due if it's not in the record. We need to know so it's in the record.
If it's not in the record, what would we give to a medical provider to help influence their decision that it's service connected. You know what? You understand what I'm saying? We're not trying to change it, but we're just trying to prove it.
Right. If you're already in, it's much easier. When I came into the military, when I passed the MEPS exam, I didn't have this, and now I do. I'm still active duty. Very easy. The actual onset date may be tricky to actually pinpoint in those circumstances, but at least you have a range, and all that range is in your active duty time. It's when you're a reservist and your other components like that it can be much trickier. But by and large, what we do is we talk about what I just said, and we also do lay statements as well. Your spouse, we say buddy statements, preferably people who are your rank or above, so there's obviously no appearance of impropriety, who can testify as to the existence of these things.
So I suppose you'd want to gather up medical records, official and unofficial records, and send those. You'd want to gather statements of people who say, after this particular jump or this exercise, he couldn't perform as well.
Yes.
And you would want evidence of 300, what back in the day, a 300 PT score now drops to a 210 or 220. Anything that shows that there's a decreased function or decreased performance, to include statements or even, secondary evaluations, I suppose, right?
Exactly, yes.
Okay, and then what would we do with that provider and providing that information? We wouldn't write the letter. We would just say, hey, would you look at it from this perspective? And we would make the arguments to try to bring them across the finish line for that Nexus level.
Yeah, absolutely. And no doctor is going to risk their license, or very few doctors, I should say, because there's always one. Most doctors are not going to risk their license to say something that's not true. That's, quite frankly, outside of their skill set. They usually want to do what they call the SOAP notes. They do the subjective analysis, they do the objective analysis, assessment, and then planning. Anything that's outside of those notes that they put into their own, Epic or whatever medical record, electronic medical record database, and what they do in the office and in the operating room, they don't like dealing with, and especially not lawyers. We try to make it easy for them. We build relationships with them, and it's one reason why we like to stay in with providers at the MTFs. They know us already. They know the lingo. They know what we're looking for. We don't have to do the same spiel, song and dance every time. We're not suing you. We develop those relationships. They know what it is we need. They give us a thumbs up, yes or no. It's easy.
So it's important what their credentials are, what the injury is, the diagnosis, the causation, the linkage to the service,
all those things.
Prognosis, effect on your functionality, right?
Yes.
Okay. And once we get that letter, then that serves as a basis for maybe the MEB for the NARSUM.
Absolutely.
Right. And that's the beginning of the process. Or if you're on the back end, it's to the VA to try to service connect them.
That's exactly right.
What type of mistakes have you seen in medical records going either to the MEB process or coming back down from the VA process?
Most of the times, oversight, careless errors from the authority that are making the decisions, quite frankly, and it's an easy fix on our end. It's very frustrating for the service member who says this is very obvious. We made a beautiful packet. They still said no. That's a simple one. Another one is an incomplete packet going forward if they didn't seek our care beforehand, or if they didn't tell us something beforehand. We cannot help you if you don't tell us. We are not mind readers. Ignoring flare-ups or functional loss, that's an important component. Every element you could think of, they didn't address it. They just completely overlooked it. Those happen a lot.
Well, if you're going through the IDES process, the MEB or the PEB, or you're going through the VA process, and you've got medical conditions that aren't fully documented in your medical record, and you need help, give us a call. We're the law office of Will M. Helixon. We are your warrior advocates. You defend the nation, we defend you.